The foundation of our ophthalmic grasping instrument is based on the iris forceps used in delicate microscopic ophthalmic surgery, as you can see here. The arms of the forceps are bent at an angle that allows the surgeon a greater field of vision. The handle of the forceps is modeled quadrangulally so that the magnifying glass attachments can be attached to any side depending on the surgeon's dominant hand and preferred working angle. Each of these four faces are machined with a dovetail rail shape. This is essential for the easy attachment of the relevant components explained below. At the proximal end of each of the four faces, there is a rounded end stop which will prevent the attachments from slipping off into the patient if the attachment is accidentally forced forward. Through the entire length of the forceps handle, a hole is drilled to remove excess weight. This improves tool balance and aids dexterity. The magnifying glass attachments work as follows. The base of the attachment has a corresponding inverted dovetail that connects to and grips the quadrangular handle of the forceps on any of the four surfaces. The base has the ability to slide forwards and backwards, which allows precise positioning of the magnifying glass attachment to account for different focal lengths and different eye relief distances. Notice how the rounded end stops prevent further forward movement. The top of the attachment base has a ball feature to which a socket joint of either a spacer or the magnifying glass component can be attached. Ideally, one spacer and then the magnifying glass component should be stacked to allow for a broad range of configurations, but additional spacers can be added as required. The magnifying glass component is then connected. Each glass focal length will be pre-made with an integral socket joint base to attach to the relevant ball joint of either the spacer or the attachment base. The range of movement of the magnifying glass attachment works as follows. The entire assembly can move forwards and backwards on the rails. The individual ball and socket joints can be twisted or rotated in any combination to position the magnifying glass at the surgeon's desired point and field of view. It can be tilted forwards, it can be tilted backwards, it can be tilted sideways, and then of course in any of the combinations of the above.